Hi everyone, welcome to the Hall Family Wines Happy Hour. My name is Kathryn Hall. I'm thrilled that you all joined today. We've got a wonderful program ahead. I've got a very special guest, Dr. Paul Nassif from Botched and from many other shows that you will know him from, but Dr. Nassif is going to be joining us in just a second. I hope you are all doing well, faring through all the crises and all the trauma that's going on in our world these days right now, and are ready to take a little time out, have some fun conversation. We'll have some great wine, and I look forward to spending the next 20-30 minutes with you. So let's bring on my really wonderful guest. So Paul Nassif, you know him from Botched. He's a very celebrated, highly acclaimed plastic surgeon from Beverly Hills. Also really a TV personality who is so well known from many shows, most recently Botched. I have known him from Housewives for many, many years, and I suspect many of you do too. Dr. Nassif said that he'll be happy to answer some questions. So if you've got some questions, bring them on and we'll try to get to them over the course of the show. And thank you so much. Let's bring on Dr. Paul Nassif. Let's see. And here he is. Paul, are you there? And he's coming. I know he's coming. And in the meantime, and there he is.
I'm in my golf attire, Kathryn.
Well, that's a wonderful piece of attire for some nice conversation, a little bit of wine. Okay.
Can you hear me?
I can hear you. Yeah.
Wait a minute, I've lost you there.
I think, well, I think we may have
I'm
maybe a little bit of a connection problem.
Here.
Okay, now you're back. And we're set. So,
I'm back,
everybody, the Paul Nassif, and it's wonderful to have you on, Paul. So tell me, you're finding a little bit of time to play golf, but I know you are super busy all the time. What's happening during COVID? Are people still getting procedures, still getting a lot of work done, or has this given you a bit of a break?
Well, I mean, I'll tell you right now, we're still very busy because now is the time for everyone to heal because they're at home. You know, I mean, right now everyone's at home. Some people say this is the best time to heal. Obviously, as you know, Los Angeles is having a little bit of an epicenter problem right now.
Oh,
Let's see.
Really
I'm losing
is.
you
It's
on
just, you are, and I'm wondering if maybe you might log out and come back in. Maybe we'll get a better
am I losing
connection
you?
if you do that. Yeah. Why don't you, I'm going to take you out and then you can come back on in. Okay, and so let me see if, and I'll get Dr. Nassif back on here. Just a second. I'll find him here. Here we go. Let me give this another try. So, Paul, I think you're coming back on. We've got you reconnecting. I'm showing that you're reconnecting. In the meantime, and there you are again. Is it a better connection?
I hope so, for goodness sake. I mean, you know, we lost. I mean, the thing is, I usually have very good reception here, so I don't know what's happened.
Well, you know, the whole world is askew right now. I think what we need to do is let's have a glass of wine. So let me, I'm going to, through the magic of the internet, we've learned this new trick that we can do. I'm going to pass you this bottle all the way down. Very nicely done. Thank you so much.
I got it. I love it. I got it. I have my 2017 Napa Valley Hal cab, and I'll tell you something. Are we gonna do after my golf game? I need a little sip.
Well, please have a little sip.
And I hope everyone else is out there that's listening is gonna have a little sip too.
Also, Paul, I told folks who are
Love that.
watching, if they want to get a question, and we'll try to take a question or two before we sign off. So people are, I'm sure, getting their questions ready. You've got so many people who are joining us who want to hear and ask you questions, as I do too. And I'll start
Well,
with this. So you were saying when we got disconnected that people are, despite all the sort of the concerns about COVID going in Los Angeles right now, but people are still trying to take advantage of this time to have cosmetic surgery done.
yeah, I mean, it's interesting. You would think that there would be a break in cosmetic surgery, especially Los Angeles being the epicenter. But we test everybody, and the people that are really safe and not going out and hanging out with big groups of people, which are the smart ones, all are coming having surgery. We're very busy still because everyone's healing at home. And as a matter of fact, I did a couple of noses today, did a facelift yesterday, and things are still very busy. And so we've been busy since we opened up back in May. We closed at the end of March, and from May on to now, we've still been very busy. But I did get time to play my 9 holes of golf. That's why I'm in my golf attire right now.
You've got, and that's, you need a release. You can't do that's doing surgery after surgery has to be such high stress.
You know,
Yeah.
but what your thing is, it's something though that I love, so it's really not that stressful. And a good plastic surgeon, you have to love what you do. And I love working on the face. And I tell you one thing, and I love is a great release besides playing golf, having a great, bold Napa Valley cab.
Thank you very much for that. Did you always just know that you were going to go into plastic surgery, into cosmetic surgery?
I did not.
No.
I originally, someone said, congratulations, my daughter, Paulina, thank you. I originally was going into, I'm a head and neck surgeon originally, called the otorhinolaryngologist. And we learned facial plastic surgery as part of our training. But what we did, though, which was a little bit fun, is I was going into heavy ear surgery where it involved surgery of the ear going towards the brain. So we used microscopes, and I was more like a neurosurgeon. That was my favorite thing. Then all of a sudden I did a nose, and I fell in love with doing rhinoplasty, and then eyes and facelifts, and that's where I'm at.
And is it just, is it the reaction that you get from people, not only when you do the surgery yourself, but I would think fixing other people's botched problems? I mean, it's just got to be so rewarding.
I think when you can actually take someone who, and again, it could be a first-time surgery because a lot of people don't know that I do first-time surgeries also. Whether it's first-time surgery or a procedure that has been multiple times, maybe not doing the best, botched, shall we say. When you have someone, you make someone happy and you nailed it, it's the best feeling in the entire world because, it's right in their face. I mean, that's what everyone sees. So doing a great job, and again, we all try, remember, we do the best we can, and hopefully we make most people happy. Can't make everyone happy, but most people.
Yeah. Do you find like some people, you'll do the changes and they don't even see it afterwards?
Yeah, so well, that happens, and we see that on the show, Botched also.
Yeah. Yeah.
We show it where patients sometimes don't see exactly, they say, well, there's no change here. I go, yeah, there is. There's a huge change. But again, that's where it comes to realistic expectations. And hopefully, when we screen patients, we want to get the right patients.
So how do you select the patients that come on? I mean, you've got a very select group of people who are coming on the show. I'm sure that's not, I mean, obviously that's not all of your patients, but how do you
So,
select the ones that come on?
so the way it works, and remember our first season of Botch where we had eight shows, we had a casting call through our casting director for Botched, and we had 500 people apply for the show. Now we have over 10,000 apply for each season.
Oh,
And there's a
goodness.
casting department that goes through the show, goes through the patients, goes through the network, and then they come to us at the end. And, we have to make sure that they're physically healthy, psychologically healthy, got to make sure that for Botched that they're going to hopefully, God willing, get a good result.
Well, they also have to be sort of ebullient. Is that your patients they're very open and they're very fun.
They have to be like that because if you're going to tell a story, you got to have them. You got to put yourself out there. I mean, for example, I've had myself 4 rhinoplasties, and you got to be able to go out there and say, "Hey, this is what happened. Here's the story." But some of the stories we get are crazy. I mean, they're crazy stories, and that's what that makes good TV. I mean, the best thing is one, you have these incredible makeover stories. You have patients that come in that have the craziest things done to them that we actually aren't going to operate on them. And then you have the banter back and forth between me and DeBro.
Yeah, which is so fun.
He's
Yeah.
the secondary doctor. I'm the primary. I hope he's listening to this right now because sometimes, he'll jump on and make some negative comments about me.
By the way, did you say you've had 4 rhinoplasties?
I've had 4. I had one when I was 17. And then the way that healed after a while, it didn't heal the best. And actually, maybe it was 3. And then my son broke my nose back in 2011. And then I had what we call a quick procedure where I used a piece of my rib like I do on the show. And then I even have another one a year later. I had another piece of rib. So I had 3 surgeries.
Whoa. Okay. Well, I'm thinking another thing that all of your patients that come on the show have to have is a lack of modesty. I mean, they're sort of like all out there when
You have
they're,
to be on the show. You have to let it all hang out, and whatever the story is, whatever happened. But a lot of these patients, and this is where it's really heartfelt, have had really bad things happen to them. And I tear up many times on the show because it's really horrible what's happened to them. And the thing is, if you can take that horrible thing that happened to them, make them feel better about themselves, then that's what's fantastic. And most of the time we do that, thank God. Other times we fail. As a surgeon, when it comes to doing very hard surgeries, you have complications. You get unhappy patients. I mean, that's just the way it is. And, any doctor who tells you every patient's happy, they're full of it. That's not true.
yeah. So, you have had the COVID vaccine, right?
I had the COVID vaccine 2 weeks ago.
Oh, and uh, have you had a reaction?
I did not. However, I don't know if this is true, but someone sent me an Instagram today from some show, and it was about it was a wife speaking about her husband who was an OBGYN who actually died from apparently the vaccine 2 days later.
Oh my God.
I don't know if that's true, but I heard that. All I know is that all my doctor friends, my office staff that have had it, so far everyone has been fine. I had a sore arm the next day, and then I'm getting the second shot in another week.
Well, actually, I think that's an important message for people who are watching because hopefully all of us will have access eventually
Yeah, I
to
mean,
a shot.
yeah. Let's talk about that for 1 minute, Kathryn. I mean, remember this for all of you out there listening. I know we're listening from. We're getting all these little flags from, especially South America. Hi Venezuela, hi Chile, hi Peru, um, and the interesting thing about this is, remember, this is called an mRNA, messenger RNA, which actually makes antibodies to the protein on the little, shall we say, these little sticks or legs. I'm saying it as easy as possible on the COVID uh, virus. So it's not a dead virus, but it's a messenger RNA that makes antibodies to a part of the virus. And now you can still get COVID. You can still probably pass it on to the people, but we're thinking that hopefully if you get the vaccines, it's going to make it, hopefully because you have antibodies, a more of a benign course.
Well, good. And I think I'm so glad that you said that because I think that's really such an important message for everybody. So, I have on a sort of more fun note, we have a little
Yes.
game that we love to play.
Okay,
And
let's do it.
okay, it's called Sip or Spill. It works this way. I'm going to ask you some questions. You can either spill the beans, answer the question, or you can take a sip. So I like
Okay.
to think that you're going to win either way. You know?
Okay.
Okay.
I'm up for that. Let's do it.
Okay. Deal. All right. First, okay. Well, the first question that I had down to ask you, I already asked you. Okay. Here's my question. When you see a stranger on the street, um, do you sort of do you think, oh, she had work done or he had work done? Or, I mean, does your profession sort of come with you with strangers in social situations outside of your operating room and in your office?
In a novice surgeon or a new surgeon will absolutely do that. Once you've been in doing this for a while, me, it's 21 years, the answer is no. The only time I do that is if someone has had a horrible facelift or a horrible rhinoplasty and they look pretty bad, then I say to myself, yeah, they need to come see me.
Mm-hmm.
But in general, I don't.
Yeah.
So in the beginning I did, but now I just try to kind of go out and not really think about it because I work so hard. When I'm out, I don't want to think about plastic surgery.
So before I came back to my job of my dreams, making wine, I practiced law for years, and I would always find myself in social settings where people were asking me legal questions, and I'm wondering if that's sort of, do you go to parties and people are asking? Yeah,
Off the streets, in a
yeah. Oh gosh,
restaurant, at parties, what do you think I need? Or can I ask you a question? And then it'll be a question about their heart or something. And I go,
yeah.
I kind of, so the point is the answer is happens all the time. And especially the only time that kind of bothers me a little bit, if I'm in the middle of actually eating and having dinner back when restaurants were open out here in Los Angeles, I go, can you maybe wait and once I'm finished eating? But the point is that comes with the territory of what I do, just like you being an attorney, you're
Yeah.
going to get those questions asked.
Yeah, you are. So, to anyone who has just joined us, this is Kathryn Hall. We're on Hall Wines Live. My wonderful guest is Dr. Paul Nassif, and we're drinking some Cabernet. And right now we're playing a game called Sip or Spill. So, and there's the bottle. And so I'm asking some questions, and Dr. Nassif has a chance to either sip some wine or answer the question. And so far, he's been answering the
But
questions.
but
Okay,
if you
let's.
noticed, I've been sipping and spilling simultaneously.
That's the best of all. Okay, next. So, how young should a woman start with cosmetic surgery?
Great question. In the old days, when I first started practice around 22 years ago, 21 years ago, um, what was happening is patients were waiting too late and they come in needing an emergency facelift per se. Now, what we've been doing, especially with a lot of our non-invasive or minimally invasive procedures, patients are starting to start early. And whether it's a little Botox, a little bit of filler, a little bit of radio frequency to tighten the skin, they're all doing it. And
Shoot, what's radio frequency?
well, I mean, there's different things. You can tighten the skin, whether it's here or your body. Like we have one called Thermi, which is a radio frequency device, and it delivers heat and tightens up the skin.
Huh.
Or there's ultrasound, or there's, we have other little bit more minimally invasive procedures called Renuvion. So these are procedures that we can use to help tighten the skin on the face, the neck, and they start usually earlier ages, maybe in their 30s. And then the surgeries usually start around the eyes in the 40s.
Mm-hmm, mm-hmm.
Nose, chin can start as early as 15.
Yeah, yeah, right. So, but so in a way, can Botox be, I mean, maybe stop you from getting wrinkles? It just,
Yeah. So Botox is a prophylactic, is what you're asking. So if
yes.
you're someone, for example, God, look at my hair. Ah, after my golf game today. If you're
It's not so.
constantly, if you're young and you're constantly doing this all the time, frowning, the 11th, then yes, um, you can start kind of early. Hold on, I got to fix my hair. Hold on, here we go. After my 9 of golf today,
It
someone
looks good.
asked, "What about the wine?" By the way, I
It,
want to become a Hall wine member. I just saw that someone said for 10 years. I want to become one because I
well,
love a bold Cabernet. So start
thank you.
early. Yes, you can start kind of early. Maybe in your late 20s, if you are constantly frowning or smiling and you're getting crow's feet. As a little prophylactic, the answer is yes. You can if you really need it.
Yeah.
That was a spill, but here goes a sip.
Oh, good. Oh, good. One of the things I love that you do on the show is when you tell patients or would-be patients that they shouldn't do something, you know, because I know you spend a lot of time sort of fixing people who went to doctors who did things they probably shouldn't have done. But it's really important to, it seems to me, to find somebody who will be honest with you.
Well, that's one thing we have to do. Oh, by the way, before I answer that, someone asked what my golf score today was. Actually, I did pretty well. I played bogey golf. I don't
What's
play that
bogey
much, but
golf?
bogey means you hit 1 over par. So if it's a par 4, that means you made a 5. So I
Oh
actually
my
played
gosh.
pretty well for me. That's not bad. Especially, I have to tell you, hold on, I got to get rid of that. I don't have time to play, but I got to tell you, I hit some incredible balls today. So I'm very happy. And but going back to what you were saying, and
Mm.
we need to always tell patients, especially when they come to my private office, uh, we tell them, if they're coming and asking for something that does not make sense, they shouldn't be having, we tell them on the show, we tell them they want to have a rib taken out, they want to have their eye color changed, they want to have they want to have their nose pinched, or they want to have their face pulled like this, like this, instead of a nice natural facelift. We tell them, no, we're not going to do that to you.
Yeah, yeah.
Got to tell them.
So, oh,
So
Lordy.
that,
So, so do you ever have anybody comes in and says, I need rhinoplasty because I want to smell wine better?
yes.
Really?
Actually, well, smell better, and that means I have to open up the airways or do a functional rhinoplasty. When we like today, for example, I did somebody who had a very large hump on the nose, um, and also, but the airway was pretty bad.
Wow.
And So with that situation, we open up the airway, and I'll tell you one thing: when you have a good airway, you can actually smell a lot better because the olfactory buds, what they're called, are high up in the nose, and you have to have an open airway to do that. So the answer, and if you're pinched, over resected from rhinoplasty, you can't do that.
Well, that coincidentally leads right into the next thing I thought we would do, and that is talk just a little bit about this wine that you have in your glass. So, so this is the we make a lot of different Cabernets, but this is the one Cabernet we make that is from. Thank you, thank you very much for
The
doing that.
advertisement.
Yes, thank you, Paul.
Go
And
ahead.
so we make this from just about every appellation in Napa Valley. So while on many of our wines we wanted to represent a particular vineyard in a glass, this is the wine that we make to try to represent Napa Valley as a whole. And so that, as you know, I mean, the Napa Valley Cabernet can be, and I think should be, elegant, but it should also be very bold. It should have a lot of rich fruit in the nose as well as in the body of the wine, and that's what I'm hoping that you're going to find in this wine too. How do you like it?
I will tell you something that this to me, I like very bold Napa Valley wines. First of all, I'm a Bordeaux drinker.
Mm.
Got to tell you. And someone asked really quick, and someone said Mabruk. Lebanese person there.
Ah,
Gifik. I'm saying hello in Arabic there. But so I'm personally, someone also asked, what do I drink? I drink a very good tequila once in a while.
aha.
I drink a little bit of scotch once in a while. But I have to tell you, someone said that Hall wine is the most beautiful wine in the world.
Well,
And,
thank you, whoever said that.
I love a very bold, full-bodied Cabernet. And I will tell you, Hall wines, to me, I mean, I do like very bold, full-bodied wines. And I tell you, this cab is absolutely beautiful.
Thank you. Thank you. You
And
know what?
I love it.
So one of the things I think that's important for winemaking, particularly in Napa. I mean, I love Bordeaux, Cabernets from Bordeaux as well. But we get so much sun and we can get so much ripeness in Napa Valley, so that I think one of the things that separates very good winemakers from great winemakers in Napa anyway is the ability to use restraint. One of the challenges in Bordeaux is to be able to get enough sun so you can get enough ripeness to get that other quality on the grape, and then it's reflected in the wine that it's made. And I think that we want to have wines that are bold, but we also want to have a wine that's elegant. So there's this sort
Are
of
we talking about
dance.
tannins now?
About what? Well,
Tannins?
tannins too. Yes, you want to have tannins in a wine. You want to have that the tannic acid that makes the wine come alive.
Pop. Hmm.
Yeah.
One
So,
thing I got to tell you though, since you sent me a case of this or a few cases, I did have some of the wine a few weeks ago when I first got it. And I will tell you, and for all of you out there listening, maybe some of you have this problem, but from the American wines, there's sulfites in the wine that get you a headache, especially in a red wine. And I even have some of these little sulfite things you pour the wine in to try to decrease it. I will tell you, Kathryn, on your wine, and I'm not doing this because remember, you're not paying me to be an advertising person, but I will tell you that I did have 2 glasses of wine, and that's for me, I don't drink a lot, but 2 glasses, nice glasses, and I woke up feeling absolutely perfect. And so from the sulfite standpoint, and again, I don't know if I'm right or whatever, because I don't know much about that, but I only know in Bordeaux's, I don't get headaches. But with your wine, no headache.
oh, I'm so glad. Thank you very much for saying that, Paul. I really appreciate it. Okay, I feel we should take one question at least because we told folks that we would. So let me see I'm going to come in here and got. Oh, I love this question. Thank you, Allie, for asking this. This is, what's one of your favorite memories from filming when you've been filming Botched?
Well, okay, this is a story which turned out to be first great, then maybe not so great at the end. We had a patient in season 3 who had some unique symptoms to her nose, and I ordered a special x-ray, which was kind of unusual for me to order, but I just had that weird gut feeling to do it. And one of my great memories on this was a mother of a little girl who had autism very severe. And the woman hurt her nose in Italy on a moped. She smashed into a wall. And some of the symptoms, when I heard her, I ordered the CT scan, and that CT scan, someone said, I remember this, had a bunch of aneurysms in her brain. If we didn't get that CT scan, she probably would have died within a month or 2. And we found him. We got her to an incredible doctor. Someone said Caparina. Yes, I've had those I've been in Brazil many times. Someone just asked me. So I kind of just answered that.
Yeah.
And so we actually helped her. We sent her to a great doctor at Harvard. And she had the aneurysms taken care of. And then she came and had her nose done. And usually they don't include me in the what we call, the reveal of the nose, but reveal of the patient. But they had me come to a restaurant in Beverly Hills, and they brought her daughter, who was autistic. And her daughter gave me a thing, Dr. Nassif for president or something. You help my mom. Now she can take me to the park. She doesn't feel embarrassed to go outside. And that killed me. I broke down on camera, which I've done many times. I sobbed because, this little girl who was severely autistic and her mom wanted to do stuff. So that right there is what makes what I do worth it. And that was one of them, there's so many of these stories, but that's the one that just came up to my mind.
Oh my gosh. And how lucky that you had that intuition for whatever reason,
Yeah.
if it's luck plus experience,
Combo,
plus
whatever it was.
expertise, yes, all of those factors. How wonderful for that family as a whole. That's just beautiful. I, I honestly could just keep on asking you questions and questions and questions, and I have so loved. I know you've been watching the little messages that have been coming through, and the hearts that are just like nonstop. You've got so many wonderful fans out there. Paul, thank you so much for being on my program and for sharing a little bit of time with us. You've just been so wonderful. Any last messages to all your fans? You got a lot of folks here who are just loving you today.
I'm reading all the little different signs. I'm seeing Greece, I'm seeing Argentina, and someone said, I miss you from Australia, right? I haven't been to Australia in a while because I sell my skincare out there. I haven't been to Australia because of what's been happening. But as I'm looking at some of these notes, I want to say to everyone who's watching, first of all, and all those great hearts there, thank you guys. I will tell you, let's talk for one second before we hang up about COVID. And this is a hard time in the world. I know it started in March. And then again, a lot of people are seeing the second or third wave. We're seeing in Los Angeles a horrible second wave, which I think will start to die down at the end of January, I hope. It's very hard to all of you out there. I want you to say is a few things. I'll make this a quick little PSA. Kind of don't go inside with a lot of people and take your masks off. That's where everyone got it after Christmas and New Year's. Wear your mask. Stay away from people. Right now, just to get rid of this darn thing and this surge that's going on. If you're going to go to a restaurant, great. Just stay away from other people. And if anything, I want everyone to be safe, take care of themselves. And then, of course, I have to plug this wine, this Hall wine. I have to tell you, I absolutely love it. And Kathryn, I want to tell you right now, because I'm so that everyone else can hear this. When we go to Napa, my wife and I, because we need a vacation. We haven't been out of the house since March.
Yes.
We're coming, and you got to take care of us.
Oh, I'm going to take such good care of you, and I can't wait, Paul. You're just such a pleasure on screen and equally so in person. Thank you so very much for coming on today.
Thank you so much.
Cheers.
Thank you so
Bye.
much. Cheers to you. Bye-bye.
Well, I hope you enjoyed Dr. Paul Nassif as much as I did, because what a wonderful human being who is doing so much to bring us a lot of entertainment on television, but at the same time also bringing so much joy and self-respect to so many people. So everybody, thank you very much for joining us. There's a lot going on in the world right now. I'm really glad that you took a little time out for us, for yourself, to have some fun. We're going to be back next week. Walt and Baca are both coming back. We've got lots more of these wonderful shows coming up. And in the meantime, stay healthy and sip up.